Script, a Jackson Health System podcast. We're bringing your everyday conversations and curiosities on health to our experts. From doctors and nurses in all types of specialties to IT gurus and historians, our guests will give it to us straight and give us a laugh or two along the way. In this day and age, it feels like there's a new health trend every week. You can't open up your social media accounts without being influenced this way or that way. We're constantly searching for shortcuts to lead us to a healthier lifestyle, but the real question is, are some of these hacks worth your time? We're going to find out. Joining us on this very first episode of On Call Off Script is Dr. Rick Arias. Thank you for joining us today.
Happy to be here.
And tell us what you do here at Jackson.
So I am trained as a family medicine doctor. I'm currently working at Jackson's Urgent Cares.
Right.
So if you want to come visit me, there's clinics all over the city.
Right.
And we're happy to take care of you.
Well, I want to start you off with this first question is, how do
Sure.
you feel about viral health trends? I'm sure you scroll and you see things. What are your thoughts?
So it can be a little frustrating when there are health trends that are being broadcasted to the public that don't have a lot of validity in evidence-based medicine. And it takes a lot of energy and knowledge to sort of sort through them and figure out which ones are helpful or which ones are harmful. And so patients, people in general, sometimes they're doing things that aren't the best for them. So it's always good to talk to your doctor so you know what's right for you.
Absolutely. And I'm glad you're joining us today
Happy to
because
help.
I want to start with a couple of viral health trends that, make their rounds across social media. Let's start with mouth taping. Put a piece of tape over your mouth to keep your mouth from opening up while you're sleeping. It's supposed to help improve your airways and then sleep and breathe better. Is that true?
This is a very good one. There's very few downsides to taping your mouth. Even though it seems so barbaric.
A little bit.
I have actually tried this one myself. Really? Yep. I no longer do it because I no longer need to do it because now I am breathing through my nose. So humans are designed to breathe through their noses. The air gets humidified when it goes through the nose. We also have air filters in our nose, the hairs, the turbines that turn the air. It's a healthier way of breathing. So we want to train ourselves to breathe through our nose. A lot of people breathe through their mouths, and it's not the end of the world. It's not going to kill you. But if we could breathe through our nose, that would be optimized. So if we could get ourselves to breathe through our nose while we sleep, that's a large chunk of the day. And so that's what mouth taping was intended to do. Try to encourage people to breathe through their nose. So just a little bit of tape sometimes can go a long way in keeping your mouth shut.
Wow.
And so that's where it started. I would say one of the downsides of it is people do have allergic reactions to these tapes. So sometimes people will have a skin reaction and maybe that tape isn't for them.
Right.
If you practice before you go to bed, breathing through your nose, as we head to sleep, a lot of the times the body will just maintain that rhythm and you'll keep your mouth shut. So the tape can assist in keeping the mouth shut, but if you can keep your mouth shut at night while you sleep,
it sounds like it's worth a try.
That is beneficial. So I think it's worth a try. It's also been shown to help with people who have respiratory issues. For example, specifically like snoring. That usually happens from breathing through your mouth. Patients who have a CPAP machine, if they're breathing through their mouth and they're not breathing through their nose where the CPAP machine is connected to, they're not using the machine. So even a piece of tape over the mouth can help encourage some people to breathe the correct way they need to.
And let me ask you, have you noticed a difference in your sleep with trying mouth taping? I know you're not doing it anymore, but...
Yeah, I breathe through my nose when I sleep, and I try to breathe through my nose all day as well. So I definitely think it has helped. On top of that, too, there is smooth muscle in the nasal passages, and by breathing through the nose, you're using those muscles. So it actually creates space by engaging those muscles and makes it easier to breathe through your nose. People who have not been breathing through their nose, those muscles atrophy. It's harder to move air that way. So it is important to try to engage it like any other muscle in the body so that you can continue to do that properly. So you get 8 hours of sleep. We should be getting 8 hours of sleep roughly.
On a perfect night.
If you get a good chunk of time at night where you can do this, it makes it easier throughout the day to keep performing that activity.
Right, because if you don't use it, you'll lose it.
Exactly.
Let's move on to another one.
All right, but that one I would highly recommend.
Rating it out of 1 to 10. 10 is the best, 1 is like, what would you give it?
So since this one doesn't have a lot of negative side effects, I would say it's on the higher side, maybe a 7. I would say since you can accomplish it just by closing your mouth, it's not going to change the game, but it could be useful for someone who's struggling with breathing through their nose at night.
Great. Let's talk about castor oil.
Sure.
Castor oil patches, it's supposed to reduce inflammation, folks have been putting it over their belly button, maybe wrapping saran wrap around them. It sounds a little out there.
I would agree. This one is a little out there. The skin is porous and can absorb chemicals. But if someone's goal is to get in their GI tract, that's not a very efficient way to get a substance into their body. If you ate it, ingested it, it would go through the GI tract, and that would be much more efficient to get something into the GI tract that's anti-inflammatory. There is a large trend on people trying to add things to their diet to assist. But truthfully, just a balanced diet is really enough to get people to where they need to go the majority of the time.
So a piece of oil over your belly button is not going to stop you from bloating, but maybe some exercise and an apple will?
Yeah, and an apple a day keeps the doctor away.
Right, but I'm glad you're here with us today.
I'm glad I'm here too. So
Awesome.
The castor oil, it has been shown to be anti-inflammatory.
Okay.
And if you ingested an oil, that could help potentially with constipation, for example.
Right.
So if you ingest something like this, it can change the consistency of your stool. I'm not recommending that by any means.
Understood.
But if someone's goal was to have an anti-inflammatory diet, then I would not start with a castor oil.
What would you start with?
Diet. Diet. In terms of the diet, some of the highest antioxidant foods are berries, for example. That's a great place to start.
Good.
Yeah.
Let's move on to our next one.
All right.
Cold plunge. Whether you do an intense workout or you just take a walk, folks are dipping themselves into ice water. I've tried it before. It's not for me.
No, it's challenging, no?
It really, really is. But does it really make a difference, or is it just a mental thing? Is it a placebo effect?
Well, to start that question off by answering you, I think mental is very powerful. If people can take control of their minds and therefore their bodies, that's incredibly empowering.
Yeah.
And I encourage people to look for ways to do that in their life. And the cold plunge, that is probably one of the most beneficial things of it. How long did you last, if you mind sharing?
Dr. Arias, at least 2 hot seconds.
2 seconds? Okay.
Yeah, I'm a baby. It's
Hey,
okay.
I'm proud of you for getting in. It's not pleasant.
No.
Especially as a Florida girl down here.
No, it's not fun for most. But does it really do the muscle relaxing? Is it good for you? Does it make a difference?
So this one is complicated because it can be very dangerous. Hypothermia can kill people. So we need to be very careful when we do this. And we most certainly should talk to our doctor if it's right for us.
That's a good first step.
Hypothermia is if our body temperature starts dropping below 95 degrees. And everybody's different depending on the amount of fat they have, depending on their age, depending on their chronic comorbid conditions, depending on their cardiac health. We could keep going. So that's why it's so important to talk to your doctor to see if this is right for you.
It's one of those trends to check on before we start making, I hate to say extreme, but those changes in your exercise routine.
I would completely agree. So some of the benefits, and I would say the foremost benefit would be the mental fortitude that you would gain from doing something like this. When you make your body uncomfortable and you can breathe through it, it gives you control, it gives you confidence, it gives you the ability to deal with stress. There's many ways to do this, though.
Of course.
People do hot yoga, people go for long runs, some people become doctors. So there's many ways that you can put yourself through stress and survive it and be tougher on the other side. The cold plunge is one of those. And so the mental fortitude, I think, is the most important thing because a lot of people don't have control over their lives. And if they can control this aspect of their humanity, it can empower them.
Speaking of control, that'll lead us to our next topic of controlling diet. One thing that I've seen a bunch of influencers do is start off their morning, they'll have their nice glass of water, they'll mix in random powdered greens and use the whisker, the electric one, and whisk up something. And green juice right there. It's supposed to reduce bloating. It's supposed to give you an energy boost to start your day. Is it really worth the hype?
So I think we have to look at each individual green juice because there's lots of different companies that sell them. You want to make sure that there's no added sugar, for example, or there's no additives. So every green juice is different. So it's challenging to just talk about all of them.
Yeah.
But if I was going to generalize and we're going to assume that a green juice is just vitamins, maybe some fiber, maybe some probiotics, maybe some vegetables ground up. All those things would be a beneficial part of a diet. But you can get most of those things from just eating a healthy, balanced diet too. So yes, this would be a good thing for some people to consume, but I don't think it changes the game if you're already eating really healthy.
It sounds like we'll give that one more of a neutral rating.
Yeah,
Maybe a 5.
I would say so. I don't think it would be necessarily harmful depending on what's in it.
Right.
But there's other means of getting it too.
Great. Let's move on to skincare. Beef tallow, beef fat products on your face. It doesn't sound the most appealing or appeasing, but does it really make a difference, or are we just lathering on extra oils that we don't need?
So I have personally not tried this one, mostly because I'm very skeptical of the whole industry. In medicine, evidence-based medicine is how we practice. We like to run tests so that when we make a decision, there's statistics influencing how we practice. The healthcare industry, it's a very hard thing to monitor. And it's not controlled by the FDA. So there's very little oversight. So when a company claims this helps your skin, what tests did they run? Did they watch someone for 60 years to see if it made a difference? Did they control just for that one variable that they changed? It's nearly impossible to.
Wow.
So it's very, very hard to follow any of these recommendations from an evidence medicine point of view.
And I can imagine some of these companies too do very well with marketing, right?
They're
very
That's very
good
important.
at using the correct words to make it seem like we're doing studies and we're testing. I've noticed some of them #1 dermatologist recommended, and how do you really go back and search that up?
I agree.
How do you know?
Exactly. So this is a hard one to look into. I tried, and I could really not find anything that showed that it was beneficial. Theoretically, if someone had dry skin, adding an oil to a skin could be beneficial. There's many, many products that do this. But also, if you added too much oil to the skin, that could not be great for some skin types too.
Absolutely.
So anybody can have an allergic reaction to anything, and not every product is good for every person.
That's very true.
Yeah.
Here's our final trend. This
All
one
right.
is a little bit more... takes a little bit of more work, right?
Okay.
It's not really one that you would see. It's one you would see on social media, but it really encompasses more of a lifestyle change, and that's intermittent fasting. And it's also not a one-size-fits-all situation either. Some people, like we talked earlier, you may go 3 days fasting, 4 days eating. Some folks may go 12 hours no eating, 12 hours eating. What do we know about intermittent fasting? Is it making a difference?
So this is also a complex one as well, because it can be very dangerous, but it can be beneficial. People all over the world don't intentionally do this, and that's called starvation. And people die from that too. So this one we should talk to our doctors about to see if it's right for us, because it's most certainly not right for everybody.
Absolutely.
Let's talk about some of the ways that it can be right and some of the ways that it can be dangerous. So a couple current trends are where people fast for a short amount of time every day. A common one is 16 hours of fasting, 8 hours of eating. And then 16 hours of fasting, if you're asleep for half of it, it's not so bad. Other people did, like you said, a 4 and 3, where of the week they fast for 3 days, eat for 4. So these are a couple ways that you can go about it. And some benefits of this is increased glycemic control. So people who are having trouble with managing their sugar, specifically like in a diabetic scenario, this has been helpful in managing sugar. People can lose weight doing this. Whether that's sustainable or not is another conversation entirely, but people can lose weight doing it. It's been shown to help with like hypercholesteremia. And so these are all benefits. Back to the cold plunge, I think one of the biggest benefits is for someone to learn to control their body and their urges. We get used to having access to everything we want. And by controlling that urge, I think it gives people a lot of confidence to go about their life. And so I think that is very beneficial. Some of the dangers of this, though, is you can get electrolyte imbalances, you can get fluid shifts inside the body that are really dangerous. And for someone who's healthy, it's not as problematic and it takes longer to reach that. But for someone who isn't as healthy, this can happen much sooner. So in the hospital, we actually hospitalize people for something called refeeding syndrome. After someone has fasted for a long time, we have to be very careful about watching their electrolytes and making sure they don't get arrhythmias or other complications from prolonged fasting.
Because it sounds like a stressor. You go an extended period without eating, and then you eat all at once, and your body is... Can we say that it goes into some sort of shock? Is that what we're saying?
Not shock necessarily in the medical terms, but it puts a lot of stress on the body. Yes, and that can be problematic. The American Heart Association specifically came out with a study where they had 20,000 patients, and they showed that it is not good for overall cardiac health in the long term. So there's data that's coming out that's conflicting, and I think we're going to need to do more studies. We're going to need to individually talk to our doctors to make sure that this is right for each patient.
It's not a one-size-fits-all.
No, it rarely is.
Right. But one thing that we have come across too, and a question I'd like to ask you is, does fasting help regenerate cells? Does it help give your body a little bit of a break to refresh itself?
It's a great question.
Okay.
So I want to talk about one specific system, the digestive system in this scenario. So those cells turn over a lot, and it's been shown that if we give those cells a break, it contributes towards longevity. It's healthier for the gut to have a break.
Yeah.
I could not find any data on how long you have to do this for. I don't know if it has to be as extended as fasting or the 3 days or 4 days, but giving your gut a break and letting your body feel hunger is not a problem.
Right.
That is a good thing for the body to experience sometimes. We shouldn't be stuffing ourselves so we're just full 24/7.
Yeah, it leads us back to our conversation about control, making sure you can take better control over yourself and your life.
And understanding your body.
Here's your final question, Dr. Arias. So all of these viral health trends we've talked about, they range on our scale from 0 to 10. But if there's one change that we could tell everybody to make, it doesn't have to be viral, but what's a healthy trend that everyone should try to adopt?
Without going into too much complexity here, because there's quite a few things we could do.
I can imagine.
I would say we all need to get adequate sleep. And that is different for every person. Yeah. It's not just the 8 hours. Everybody's different at different phases in their life. But getting more sleep has shown to contribute to longevity, help us form memories, help us regulate our emotions. We most certainly age faster when we're not sleeping as much as we should.
Oh, Dr. Arias, tell that to my newborn who's keeping me up all
Congratulations.
night long. Thank you. But
you're welcome.
That's really important to share. You wouldn't think that sleep would be such an important factor in overall health. Most people think of it just as, this is the time for my body to shut down and stop. But what are the different health benefits that happen during sleep that
so the ones that we just discussed are really important. But there's protein aggregates that clump in the brain, and they get cleared throughout the day, they get cleared throughout the night as we sleep, and it allows us to function better the next day. But sleep is vital. We don't honestly know everything about sleep yet. It's a whole field of study, and people go into sleep medicine as a specialty. So we have more to learn, but just off the top of my head, increased memory, increased performance, that's including athletic performance and performance in an academic center, longevity, emotional regulation, all of the good things. Yeah, all the things you need to be a happy and productive human.
And that's the one we're rating 10 out of 10.
That's 10 out of sleep is 20 out of 10. Yes.
Thank you, Dr. Arias, for your time and really your expertise on some of these viral health trends. So some of these hacks, you're really going to want to speak with your doctor first before making any big changes. Sometimes nothing replaces a healthy diet and regular exercise. Thank you for watching On Call Off Script. Make sure you stay tuned for our next episode and follow us on our social media accounts at Jackson Health.